This is our brand new interface for our serious spinal pathology assessment application. We can see on the front page that we start off with risk factors. We have a series of questions that have been designed by expert clinicians, all questions that are part of the usual clinical consultation for a patient with back pain. You don't have to answer all of the questions, you can choose which ones are relevant to you. Once you're done with risk factors, you can move on to signs and symptoms, again asking the patient what they've been experiencing. If there's anything you're unsure about, there's an information box by a lot of the questions that gives you a little bit more information about what that question is looking for. Continuing to work your way through the questions, again, you've got a little bit of an aid memoir for some of them where there is a lot more information that you might need, particularly if you're unfamiliar with the signs that you're looking for from that question. Working through all of the questions, once again, they're all optional, so you can just answer the ones that you think are relevant to the patient that you're assessing in front of you. Once you've completed all of those, you can scroll up to the top and you can perform your prediction. And what we have here is a summary on the left-hand side of all the information that's been input for the patient. And in the main part of the screen, we can see a risk prediction for each of the serious underlying pathologies that you might find in patients with back pain. We can see here this particular patient has got an increased risk of cauda equina and fracture, which is indicated by there being more red in the icon array. Further down, we can see that infective condition and inflammatory condition, slightly less probability, so slightly more green on the graph. We also have some information about some other conditions that may also be having an effect on these patients that present with red flag symptoms. If you're interested in learning more about the future of our projects, then please do follow us on our socials, where we will post regular updates about what's happening and how you can get involved. Thanks.